Oh, you just might need a rubber for that. What do I mean? Hear this story out. I'm Goddess Raven, and this is the Goddess Raven Show, and I got a story for you. Ooh, break out the rubbers. Make sure you keep your rubbers on you because you're going to need them. You're going to need rubbers for this story, I tell you. All right, no, I feel like I want some red. Maybe something red. There you go. That looks good. Yeah. Okay, so now let's get all up into this. So the number of sexual transmitted diseases reached an all-time high in the US for the sixth consecutive year. A, a news report finds in 2019 there was 2.5 million cases of chlamydia, gonorrhea, and syphilis, the three most common reported STDs, according to the new data published by the Centers for Disease Control and Prevention on Tuesday. This marks a nearly 30% increase in STDs reported to the Federal Health Agency between 2015 and 2019. What more, the most striking increase was in syphilis cases among newborns, known as congenital syphilis, which nearly quadrupled over the past 5 years. Less than 20 years ago, gonorrhea rates in the U.S. were at a historic low. Syphilis was close to elimination, and advance in chlamydia diagnosis made it easier to detect infections. The progress has since unraveled, and our STD defenses are down. We must prioritize and focus our efforts to regain this lost ground and control the spread of STDs. An STD is an infection that is passed from one person to another through sexual contact, either through VAD, cat, mouth game, or the back door, honey child. Some are bacterial infections that are curable with a single dose regimen of penicillin, baby, antibiotics, while others are virtual. Ooh, I just can't. Ooh, child. I'm starting to itch. So let me finish this story, baby. All right, now. Some are bacterial infections that are curable with a single dose regimen of antibiotics, while others are viral infections that cannot be cured but can be, managed with antivirals, okay? STDs do not always have symptoms, and if left diagnosed, undiagnosed, and untreated, can have serious health consequences. Some infections can increase the risk of HIV or cause chronic pelvic pain, pelvic inflammatory disease, and even infertility. So currently, STDs cause about 2.7 deaths per 100,000 people, primarily due to HIV and HPV, human papillomavirus. I had to, burp. Okay, for the report, ooh, for the report, the CDC looked at common STDs in the 2019, which did not include cases of genital herpes, HPV, or HIV. Data showed 1.8 million cases of chlamydia. Y'all, do you hear this, Raven Gang? 16,000 cases of gonorrhea and 129,000 cases of syphilis. Ugh. Well, in 2000, there was only 7. But I mean, so that went down a little bit because in 2000, there was 709 cases of chlamydia, where in recent years it was a 616. So it went down a little bit, okay, of chlamydia. And then the cases of gonorrhea and syphilis was only about the cases of gonorrhea was only 363,000. And then for syphilis, it was only 31,000. Ooh, the report found that there are disparities in STDs, which continue to hit racial groups, gay and bisexual men and young adults the hardest. Hispanic people were up to twice as likely to have an STD compared to white people, and African Americans were up to 8 times more likely. Gay and bisexual made up nearly half of all of syphilis cases and had rates of gonorrhea that were 42-fold higher rates of heterosexual men in some areas. Additionally, young people between the ages of 15 to 24 accounted for 61% of chlamydia cases and 42% of the gonorrhea cases. Focusing on hard-hit populations is critical to reducing this problem. To effectively reduce the disparities, the social, the cultural, the economic conditions that make it more difficult for some populations to stay healthy must be addressed. These include poverty, unstable housing, drug use, lack of medical insurance or regular medical provider, and high burden of STD in some communities. Y'all, keep your cat trap and your stick to yourselves because, baby, it's burning out there. The report also found that the rate of congenital syphilis was 48.5 cases per 100,000 live births in 2019, which has been rising every year since 2013. The rate represents a 41.4% increase from 2018 and a 291.1% increase from 2015. This increase also led to a rise in syphilis stillbirths, increased from 79 to 200 in 2018 to 94 in 2019. Y'all, I'm not reading no more of this. I'm just trying to tell you that you know what? Be safe out there, y'all. Be safe because that is ridiculous. That is just way too much right there. Y'all be safe out there, please. Make sure y'all use y'all rubber because I'm telling you, there's a lot out there, baby.